variant, small cell variant, which is, instead of being 600 cases a year, it's like 10 cases a year. So super duper rare. The chemo in the beginning worked okay, but not great. It was like 80–90% dead, I think, when they did the amputation, if I remember. Not 100%, but not completely dead. And ever since then, we've been chasing these microscopic cells that go around the body. And you do chemo for it, be hoping that the cells will be sensitive, that they won't be resistant. You know what I mean by resistant? Just like with bacteria, can you be resistant to antibiotics after a while? Cancer cells are even smarter. They become resistant to the chemo. And if I sat down and wrote down every drug we've tried, oh my God, there's 15 different drugs we've tried. All the ones that are on the list, but everything that's not on the list.
Right.
And they all have worked to some degree for a period of time. You know, the period of time. I think he's had some stretches of 2 years maybe without cancer-free. About
2 years.
Maybe 2 full years or something like that.
Going back to work. And
Yeah. So there's been some stretches, but still, there's looking back at it, that means there was still some cells somewhere in the body that were resistant that we were not able to find and eradicate. And of course, surgery and radiation has been done as well. So by now, the cancer cells are really resistant, any that are left over, to any drug. But even if they weren't, could his body handle it? Because we've just beat the hell out of his body. I mean, you could not have a stronger person. And if you could, I mean, a young man who's doesn't smoke or drink and who's a policeman, I mean, this is like, wait, isn't one of you guys from a soldier in Afghanistan or something?
I've been there as a contractor.
Yeah, I mean, this is like the strongest young person you could ever look for, a young man at this age. And it shows that if you're thinking, have we tried everything? I mean, this would have killed anybody else, all the drugs I've given him. His body is so strong that you can see what it's done to him, but we've gone totally maxed out. But anyway, now he's got it in his lungs. We were saying probably a third of his lungs have been removed already with surgery, maybe even half his lungs. But he's had I mean, how many surgeries did he have in his lungs? I don't even know. You count all the different ablations and the catheter.
3 on the back.
So, and then once it gets into your spinal cord, of course, he was paralyzed basically about a month and a half ago. And then once it's there, it can spread off the spinal fluid into your brain, which is where it is now. Can't do surgery on the brain. It's kind of coating his brain on the outside of his brain.
On the skull?
Inside.
Okay.
Inside. So if you've heard of meningitis, I was telling the family, meningitis and you know how horrible that is. That's when coating your brain with bacteria and pus. So instead of coating it with bacteria and pus, it's being coated with cancer. And not just any cancer, this is a cancer that turns into bone. It basically forms bone. So all these things in his lungs are like chunks of bone, as big as golf balls. It's like around the outside of his brain is a bone essentially that's being formed by the cancer cells. And you can imagine how much that hurts and the pressure of squeezing on it.
Is it the same cancer from the very beginning?
It's always the same cancer.
Yes.
Yeah, I'm glad you asked that because people don't realize that the name of the cancer is where it comes from. It's not where it is. In other words, cancer in your brain is still osteosarcoma. It's not brain cancer. Cancer in your bone is not bone cancer. It's breast cancer, whatever it started. So this is still the bone cancer. Was it?
Just travels.
It just travels all over. I mean, and the problem is that the chemotherapy, it's like evolution. You keep selecting out who survives this round of chemo, the strongest ones, and then that starts to spread and come back, and then we attack it with more drugs, and who survives that? Again, only the strongest ones. So we've almost like survival of the species, like evolution, we've selected out stronger and stronger and stronger and more aggressive clone each time, more aggressive cells each time. And at that point, the cells are getting more and more aggressive and harder to kill. His body's getting weaker at the same time, so you go from...
Because in the beginning, it didn't seem to be spreading so fast or
Right.
as aggressive, and now all of a sudden, the past couple months, it's...
That's exactly what happens. It's, like who's going to come out of a again, if you're thinking of a war analogy, it is like war. Who's going to survive all this, firepower that we're putting on and atomic bombs and everything you can try, and then who's going to survive? Only the very, very strongest. So that's why it's definitely picked up speed in the last few weeks, and that's what we see. It just starts to go everywhere and grow fast. When people have cancer, it takes so much of your resources. By your resources, I mean your blood supply, your energy, your oxygen, your everything. But people are just exhausted. They feel like they're running a race constantly, and that's why they lose weight, have no energy. It's taking all of the energy is being taken up by the cancer cells, feeding the beast. That's why he's even if you're eating a lot, and then at some point your body just stops being hungry. But
Crystal said at this point it's miracle. What does that look like?
yeah, it is a miracle that he's still alive. Honestly, I mean, if you were to go home and Google osteosarcoma relapse or osteosarcoma that is metastatic, you would see that at 2 years from that point, only 10% of the people are alive. And that's the first time it's relapsed. And depending on how it counts, it's probably come back 2, 3 times. I mean, you can count it different ways. So 3 times, 4 times, 4 times. And by the time you can't read on the internet 4 relapses of osteosarcoma. There's no such thing. I mean, but basically, there's no such thing. No one's had 4 relapses of osteosarcoma. They don't live through that many. So yeah, he's definitely a miracle in that sense, but it's not a miracle if you're not alive. If you can't. But the fact that you live 6 years, I mean, it's Eric. It's not, and there's no
And then you
explanation.
have a lot to do with it. You're his God.
I'm sorry. You guys, great to see you guys here. It's really amazing. You know, you have this selfish moment. You're like, this many people wouldn't show up for me if I was sick. You know what I mean? That's really cool, right? And for you guys too, right? Fucking sucks. Sorry. Just you guys showing up. It takes a lot of courage to show up. I think, especially for young people. I guess I'm not a young person anymore. It takes a lot of courage to show up. Every part of your body, every part of your emotions is like, get the hell out of here. I mean, you don't like being here. It's uncomfortable. You don't want to be around someone who's, and you don't know what to say, you don't know what to do. But just showing up means so much to Crystal and the family. And it's such a powerful, normal instinct to run away from that. It's completely normal. I can feel it too. Like, get out of here, man. Right? But the fact that you don't get out of here says a lot. I thank you for that. You know, especially a time of your life where that's not on your agenda. It's not the kind of thing you think about. And you should, right, it's that mindset.
Yeah.
Crystal is, you guys are all connected. You guys know Crystal. And if you're married or your fiance, be there for her. Right?
Yeah.
Sounds like the policeman did the right thing in terms of the pension and stuff.
Oh.
Were you at the meeting?
No, I wasn't at the meeting.
But it's, yeah, and it sounds like they did the right thing. She's going to get his pension and stuff.
Yeah, that's all.
So that's great.
Taken care of.
That's really great. I think what we usually see is that what happens next is the patient is very often there's a period of time where you talk to everyone, you kind of like talk to everyone they need to talk to, say all the things they need to say, and then when they feel ready, it's amazing to me, the human spirit. There might be some special date, 2 weeks from now, 3 weeks from now, some special event. Is there something coming up that's
His birthday,
what, his birthday?
29.
29th.
He'll be 30.
And you see that a lot. And then you get to a certain point, and once, especially someone this strong, the reason he's living is because he's so strong, and because his willpower. And at some point, when he's ready, Crystal and you guys, you'll, 2 weeks from now, 3 weeks from now, I don't know, baby, you say to him, okay, Eric, it's okay now. It's okay. You don't have to fight anymore. And usually when you say that, once the loved one say that, because he's holding on for her, he's holding on for you guys, because he doesn't want to, it's almost like you're not ready yet, but at some point, you guys, you say it's okay. And maybe you've seen that already. You're already starting to feel like he's hanging on for your sake, which is a great testimony of love, right? To suffer like this for somebody else. I mean, that really is a great testimony. But at some point, you say, okay.
Yeah. Well, yesterday he said.
You don't need to do this for me anymore.
He said he's been fighting, and he said to Crystal, no, I can't give up.
It's not giving up, right? You have to.
No, he said he's done.
He's done. Yeah. I mean, it's so, you're sick and tired of being sick and tired. You know what I mean? It's real courage, it really is. I'm so impressed, especially having a bunch of dudes who are all macho and tough. It's really cool that you're, it really is, I mean, because it's not easy to let yourself be touched and show emotion. It's not easy at all. Especially your age, I don't think I could have done it. So,
I mean,
you guys are
he's
good
done
guys.
that for us.
Yeah, I can tell, that's great.
So,
You guys are all,
gotta be
you guys
there
are, sounds
for
like
him,
you're
so.
all a band of brothers, right?
Yeah, we all grew up together, so I know it's cool. We got our own little things with them, you know. You guys have your motorcycles with them, we have basketball.
You have to draw me up to make a picture and draw me back. They're all different connections, right?
Yeah, we all did, I mean,
That's cool. All those different personality parts, right?
yeah.
Mob family and.
We're your mob family, right?
That got cut out when he became a cop.
Yeah, right?
He's a dirty cop.
Yeah.
So make sure of that, yeah. Someone on the inside.
Crystal's just being so brave, but she's a kid too. I mean, not a kid, but
He's human.
she's, you know, she's just, it's. Well, I love him a lot, which is not good career strategy. What are you gonna do? He's a cool guy, right? He really is, and it's exhausting to keep having these patients that I get close to, but he's such a great guy. You guys have other questions for me?
No, thanks for talking to us.
Yeah,
Sure,
yeah.
sure.
Understand more.
Put it in my level.
Yeah.